Our next guest is the owner of a company called Genesis that literally makes babies. She's an expert in fertility, and 2,000 new lives owe their existence to her and her team. She faces some of the greatest challenges and in so many cases had made the miracle of a new life possible. But she's also keenly aware of the complex dramas that swirl around this existential function without which human society would not exist. Please welcome Sonya Kashyap.
Thank you for having me here tonight. I'm truly honored to be in all of your presence, and that's a hard act to follow. So I thought I would tell you a little bit about myself. I grew up in St. John's, Newfoundland, the eldest daughter of immigrant parents. My mother later became a single parent, and she gave up her personal dreams for those of her 4 daughters. I came to Vancouver circuitously. I studied at Queen's, I was at the University of Ottawa, I studied at Cornell Medical College in New York City, and the University of California, San Francisco is where I worked before I returned home to Vancouver. I returned to Vancouver with 2 dreams. Number 1, to bring what I had learned at renowned fertility centers in the US home to Canada, and to advance fertility care and success rates here. And number 2, hopefully, to settle and start a family of my own. Helping couples and individuals build families is an incredible privilege and an awesome responsibility. Today, with assisted reproductive technologies, we can not only cure infertility. There's very little in medicine that we actually cure, but we can actually diagnose lethal genetic conditions before the embryos are transferred into the uterus, thereby preventing the suffering of future generations. And today, we can also help couples and singles have opportunities to choose when they will start their family. In 2013, at the age of 41, I became the medical director of Genesis Fertility Centre. The byproduct of that decision was that my focus would be on my practice and less on my personal life. My mother asked me, what had she done wrong? She said, why were her daughters not having children, and when would she be a grandmother? I told her she had done everything right. She had raised us to be strong and independent women who would work diligently to make honest and meaningful contributions to the world. She had given me the dreams and the determination that so many parents wish for their daughters. And in that moment, I realized that those dreams and that determination would help other families to build the dreams of a family of their own, even if it delayed my own. In many areas of medicine, we have been able to narrow or close the gender gap. We recognize that different diseases present differently in men and in women. And even the same diseases can present with different symptoms or different risk factors, and so we treat appropriately. One area where we now have the opportunity to be so much more successful is what I call the fertility gender gap. This gap is real, and it still exists. As women, we are given a finite number of eggs during fetal life in our ovaries, and they start to decline even before we hit puberty. Egg quality also declines precipitously after ages 35, 37, and 40. Therefore, more women will experience miscarriages and infertility after these ages. Why is this? Well, from an evolutionary perspective, this made some sense in the past. After all, as women, we have to carry a pregnancy, and presumably, we should be healthy enough to do so. As yet, men cannot do it. But stay tuned. So, it is true that Mother Nature built a biological clock into our eggs. She didn't know that we would live longer and healthier lives, and that we would be trying to balance family and career. She didn't know that we would devise methods through science and technology to help us achieve pregnancy and families when we were ready. As you can see here, men also suffer from a decline in fertility, but not as drastically. Men make new sperm every 2 months. So no matter a man's age, his sperm is only 2 months old. Also makes some sense. Egg freezing can help close the fertility gender gap. That people are starting their families later in life is often not by choice. It takes longer to finish your education, it takes longer to establish a career, and it takes longer to find a partner. And we all know that in Vancouver, it takes longer to find a house. Many of the women who present to us for egg freezing do so after age 35. They are artists and actresses. They are doctors and lawyers. They are scientists and engineers, but they haven't met their partner yet, and they deserve to meet the right partner. Professional women are faced with choices that professional men are not. Since the time of suffrage, we have fought for the right to vote, for the right to work, and for equal pay and promotion. Some suggest that we should focus on career and education and independence, but then it can be difficult when we try to start our families. Others suggest, well, why don't you start on family first? But sometimes after the loss of a spouse, we find ourselves alone, and it's difficult to support the family with limited skills or means. Reproductive freedom is essential for women to enjoy equality at home and at work. Today, with assisted reproductive technologies, we can finally, truly attempt to plan both family and career. In the past, equality at work really focused on the prevention of childbearing. Contraception was legalized in the 1960s, and abortion was decriminalized in the 1970s. These are important milestones in reproductive health. But now, in 2017, there should be no glass ceiling for women, personally or professionally. We recognize that parental leave and stopping the clock is necessary for women not only to contribute to the workplace, but to thrive in the workplace. The question is, can we now stop the biological clock so that the race against time to start a family is more manageable? The answer is yes. The technology for egg freezing was perfected in Italy, where it was, by law, every egg that was fertilized in an in vitro fertilization cycle had to be transferred to the uterus. You can imagine the dilemma when twins, triplets, and higher resulted with frequency. Egg freezing then became used more frequently for medical fertility preservation. So for cancer and other patients whose fertility was threatened by their disease, medical fertility preservation allowed them the hope of having a family after their disease was in remission. But this technology took a long time to perfect. This little tiny egg, so powerful, but so fragile, 120 microns. It is the largest cell in the body, and it is the most water-laden cell in the body, unlike the sperm, which is literally a packet of almost indestructible DNA. So egg freezing was difficult to do. As the eggs were frozen, the eggs were prone to developing crystals that could damage its delicate and very intricate machinery. But today, we can now successfully, through fast freezing and vitrification, freeze and thaw eggs for use when we are ready, whatever ready means. Today, 10 eggs frozen before age 35 have better than a 60% chance of a successful pregnancy. We were proud to introduce this technology to Vancouver and to have the first egg freezing baby in Vancouver. Today, many women elect for social egg freezing. I believe that women deserve to understand their reproductive options. I believe that education about egg freezing is as important as education about contraception when it comes to family planning. In 2017, there should be no glass ceiling. And egg freezing is one way to help close the fertility gender gap and offer women reproductive choice, and hopefully help our mothers fulfill their dreams of seeing their daughters have all the choices in the world.